my name is Casey. I'll be the nurse taking care of Jim today, and I'll be explaining some electrolyte lab values for him. Say hi to my patient, Jim. Hi, Jim. How are you? Do you know much about electrolytes and the lab values? No? Okay, well, let me explain that for you. So some of the testing that we're going to be doing today will be including the anion gap, calcium, chloride, magnesium, phosphate, potassium, and sodium. First, we have the anion gap. That's a measurement that can measure acidosis or alkalosis. It's the difference of adding sodium and potassium, subtracting chloride and bicarbonate. So it's an equation that they get the number for the anion gap. Some things that affect anion gap are the toxins and drugs that can affect it. Fasting and starvation can affect it as well. It's just a simple blood test, and the normal levels are 10 to 14 MEq per liter. The next one is chloride. Chloride is to diagnose acid, base, and water balance disorders. Certain drugs affect chloride. Excessive IV infusions of saline can affect chloride levels. Some signs of increased chloride levels would be high blood pressure, weakness. Some signs of decreased chloride levels would be muscle twitching, shallow breathing, and hypotension. You need to fast for at least 8 to 12 hours before this test. And the normal levels are 98 to 106. The next one is potassium. Potassium is an important electrolyte level. It measures nerve function, muscle function, and cardiac output. The normal levels for potassium are 3.5 to 5.0. Some drugs that can affect potassium levels are glucose and diuretics. Some signs of high potassium levels are weakness and arrhythmias. It can also cause cardiac arrest if it's too high, so it's very important to keep those levels within the parameters. Low levels can show signs of muscle cramps and arrhythmia as well. Make sure you're not pumping your fist when this blood draw is done, because it can affect those levels. It is just a simple blood test. Sodium is our next one. Sodium determines fluid balance. Many drugs affect sodium levels. Some signs of high levels of sodiums are dry skin, excessive thirst, lethargy. Some signs of low levels are nausea, confusion, and seizures. It's just a normal blood test, and the levels that are normal are 135 to 145. The next one is magnesium. Magnesium is to evaluate skin function. Some factors that affect magnesium are drugs like lithium. Some signs of high magnesium are lethargy, flushing, nausea, and vomiting. Some signs of low magnesium are muscle tremors, twitching, and nausea, vomiting. You should fast for at least 4 hours prior to the testing, and you should be lying down. Normal levels are 1.5 to 2.5. Next is phosphate. Phosphate is to monitor kidney function and bone health, and it's always monitored in relation to calcium levels. Some signs of high phosphate are muscle cramps, bone pain, and itchy skin. Some signs of low levels are muscle weakness, irritability. You should fast for this one, and we should note any stressful events prior to testing, because it can elevate your levels. And we got to note the time of the day, because levels are higher in the morning and lower at night for phosphate. Normal levels are 2.5 to 4.5. Next one is calcium. Calcium is monitored for kidney disease. Some things can affect calcium are vitamin D and excessive calcium intake. Some signs of high levels are muscle weakness, nausea. Some signs of low levels are muscle cramps and tingling in hands and feet. Normal levels are 1.5 to 2.5. You should relax and avoid calcium supplements 8 to 12 hours prior. And that's about all. I hope you understood everything. If not, let me know if you have any questions, and you can take this home for your reading further. Thank you. Have a good night.